Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize ti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Nibo bofirirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito bataako.
Tubateeko tuli kujja mu kulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana do kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imwazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card. Mudikola.
Nti naba akolene ya.
Ne debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu. Ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ikop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
The short and big shot.
Omumwa gonfukidde omumwa Zubeida. Kando night ogimanyi. Bagita kando night gwokutte gwobba.
Bawa wa sugar teyamazanye ku live.
Vamo jechiri. Vamo.
Bendera ddala.
Omusajja ate nga anakuswaza ajja kwana black sugar.
Abasajja munyiganga tebabati.
Noyingira n'atakubuuza. Ekibonyaabonya ababoda abasinga. Financial literacy. Oli abeera n'etaano ate nagenda n'akwanamu. Agala mutabani wange wakati w'emyaka alina okubanga ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kye nayagala ku ttiimu ya Mama Fiina.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Hey yo, what's up my people? This is the baddest Azari right here on Executive Media with RealTime with Mimi. Stay locked in. Yeah.
Don't start talking about age.
This is a scientific fact. I can't run away from it.
Yes.
Because the older we become, the less the quality of both the eggs and the sperms.
Maybe with age and again we're putting on family planning.
So family planning is not necessarily directly linked with infertility.
Wow.
Yeah, it's not. And normally when people come for family planning, we advise them.
Okay.
And we tell them family planning just affecting fertility. I know outside there waliwo conceptions and myths
about family planning. Yes, they will tell you
yeah.
too much of family planning, you're not going to conceive.
Not really. Family planning will only stop or prevent you if it's hormones or what causes hormones. It can stop you from producing your eggs. At that time, it causes a family planning. But after you've stopped it, your system resets back to normal and you resume with the process.
Okay.
Well, there are family plannings in IUDs. They don't affect, especially the non-hormonal IUDs. They never affect your eggs. Kati osigala nga amagi go gakola ki? They get formed every month. Your eggs are getting formed and released. So it doesn't affect your fertility. Now, of course, it's a misconception out there that oba family planning
togenda kuzaala.
That is not necessarily true.
Okay. Yeah. So you were talking about age.
Yes.
Which age?
So the best age for reproduction, and this is evidence, these are facts, not my stories. The best age for reproduction is normally between about 22 to about 35 years of age. That is the time when amajigo gali in the best quality. Okay, best quality around that time. For men, the best time of conception should be before 40 years of age. Okay? So when you clock 35 years of age, it's like you had wakumye chintu mu store kumala banga. So the longer you keep something in the store, the more older it becomes. Sicho?
Yes.
Oba ina motoka n'otekawo ku gundi ku garage. Then you leave it there for 10 years. Then waliwo mulala yamuleka for 15 years. The person who has left it there for 15 years is going to have, the car is going to get more spoiled than someone who has left it there for 10 years. So when you reach 35 years of age as a woman, the rate of decline of the eggs is faster.
Subira buli omu ali bulungi kamera nkula.
Akulindemu omuntu bw'aba akola mulinde.
Abadde ogamba ki wamma? Okay, it's a fresh morning. Kansubire muli bulungi ku Executive Media. Subscribinga, likinga, bomala osharinge. Nga bwe nabagamba nti buli week tugenda kubeeranga ne Dr. Atubuulireyoko obuntu butonotono ku ebyo bye tuba twetaaga ku bulamu bwaffe naddala ku sayidi yaffe ey'abakyala. Sayidi y'abaami naye bajja kubeera nga bamufuna bwe banaaba nga batuusizza okubeera nga nabo bafuna ebibuuzo byabwe, but me specifically ndi ku bakyala. So olunaku olwaleero tuli ku TMR Hospital nga bulijjo wano e Naalya, era ng'olwaleero tugenda kwogera ku fertility. Ayina ekibuuzo kyo bw'onaabeera toli contacted na Dr. by'anaabazzeemu ng'osanga ekikyo takizzeemu, please comment with your question. Nja kukomawo nkimubuuze any other day. Good morning, Doctor.
Good morning, Zubeda.
How are you?
I'm very, very fine, thank you.
Happy to see you today. Happy New Year.
Happy New Year too.
Happy 2026. Are you ready to cast your vote?
Yes.
You're ready.
Please make sure you go and vote.
Yeah, they don't have to vote,
yeah.
but it's very important you go and cast that vote.
Yes, it is. It is your right to vote.
Yes, Doctor. So today, Doctor, I want us to talk about fertility.
Sure.
Omuntu ali eyo ayinza obutamanya what is fertility. Right. Fertility chechi.
Okay.
Can you break it down in some, even you can use some bit of Luganda?
Okay.
Yes.
Okay. Our listeners, thank you very much for yet another opportunity to share with you. I'm Peter Dr. Eladu Emmanuel. Nkola wano ku TMR International Hospital. I'm an obstetrician gynecologist with interest in fertility and reproductive medicine. Ensonga ya fertility, fertility is a condition that affects men and women in reproduction. Okay. So it affects both men and women in reproduction. Definition of fertility is failure for a couple to achieve a pregnancy for 12 months, despite having regular and protected sex. It can be as simple as that. This couple, they have been regularly having intercourse, era tebakozesa contraception oba family planning yonna okumala banga nga myezi 12. Okay, so that alone, if you have done that, engaged, and then you have not achieved the pregnancy, I would tugamba nti waliwo problem. There's a problem for us to investigate. Yes. For people older than 35 years, we may only consider myezi mukaaga, 6 months. But for those less than 35 years, we consider 12 months of regular sexual intercourse without contraception. The other challenge is that what is regular? Kubanga waliwo bajja and they tell you, doctor, my husband is in Dubai. He comes once in 6 months.
Yes.
Okay? And I've failed to conceive. You see infertility. Kubanga for us to say nti someone has infertility, we know kwelanga mwegata 2 to 3 times a week.
Okay.
So that is regularity, 2 to 3 times a week, and you're not conceiving for 12 months, then we say that there's a problem with fertility.
Okay. So, doctor, I have a lot of questions here for mothers there or for women out there. So how can we improve on our fertility?
Sure.
Like if I'm looking for a baby and it's now like 3 years, 4 years in marriage, I don't have a baby, I'm not conceiving. How can I improve?
So, again, this problem is really, really serious. And to just give you a perspective, 1 in 6 people globally face a challenge of fertility in their lives. So just imagine when you count 6 people, 1 out of those 6 people is likely to face a challenge of infertility.
Why?
So it's a very big issue. And what I usually want to do is to simplify it. That it takes 2 people to have a baby.
Yes.
Okay? So it means it takes a husband
And a wife.
and a woman, or a man and a woman to have a baby.
Yes.
Number 2, there are things that can affect only women and prevent them from having a successful pregnancy. Now, there are problems which can also affect the men, which affect them from conceiving. Now, to understand how to improve fertility, I could say there are lifestyle changes that we have to do. We have to, 1, watch our diet. Okay?
Diet.
Yes. So
Diet.
diet is very important. And usually when you're having a healthy diet, and that refers to a diet that contains fruits and vegetables, because this provide antioxidants, kati buno buyamba the eggs amagi and the sperms to form effectively.
So our diet helps
Yes.
us so much on
The
fertility.
diet is very important in terms of fertility. Ekyokubiri, exercise.
Oh, wow.
So,
Are you talking about gymming?
not gymming, but
Which
any form of
exercise now?
exercise.
Like?
Any activity that helps you to sweat
No.
for 30 minutes, a minimum of 3 days in a week. Okay? You can run, so
Yes.
rakubuka. You can dance, okay? It makes you sweat. You can skip a rope, okay? You can go to the gym.
Yes.
You can afford to go swimming, all right?
So there is no way we are running out of exercise.
There is no excuse out of
There is no
exercise.
excuse.
Yes, so you need to exercise. Exercise helps balance the hormones. Abachala. Waliwo abachala tebafuna periods buli mwezi. But when we advise them to exercise, the exercise helps to balance the
Yes,
hormones.
I can testify that.
And then the periods become regular.
Yes.
All right? The exercise helps to improve the quality of the eggs.
Wow.
Okay? Exercise helps improve the quality of the sperms for the men. Okay? So exercise is very, very important. Number 3, weight loss. infertility is very common among people who are dealing with weight issues, okay? And the reason is, if the weight is beyond what we call the normal BMI, normal range, kati waliwo range that we consider to say nti omuntu ono ali normal BMI, waliwo ali obese,
Yes.
waliwo ali overweight, omulala ayinza obeera extremely obese. So the more you go beyond the BMI, the harder it is for you to conceive, because the weight affects hormones. Okay, people who tend to be beyond the body mass index (BMI) tend to have uncontrolled hormonal levels. Okay, kati when you lose weight, the hormones also stabilize. The blood flows better in ovaries. The blood flows better in the testes. So that improves on the fertility. Number 4, alcohol consumption.
Both in men and women?
Both in men and women. When patients come to us for fertility treatment, one of the things we tell them, stop alcohol. Because alcohol affects the quality of the eggs, alcohol affects the quality of the sperms, all right? And so during the treatment time, and even those who plan to conceive, just tone down or completely stop alcohol.
Okay.
That improves on the quality of the eggs and the sperms. Number 5, cigarette smoking. And in our current era, we have an endemic outbreak. What abantu bangi banywa shisha,
Yes, yes.
vaping.
But they say shisha has no problem with.
They are all the same.
They are-
Shisha, tobacco, vaping, and you don't even have to be an active smoker. Or you can be a passive smoker.
Yes.
Ntude wano, waliwo anywa shisha, and then I'm sitting next to them, and they're blowing the smoke to my face. I am also taking that smoke. And the smoking affects women more than men. Why? Because the smoking rapidly causes the eggs to get destroyed. And remember, women are born with all the eggs. So when you destroy your eggs, you don't form new eggs. Unlike for men, whose sperms are produced every 3 months, so the smoking really, really affects women.
So eggs are not produced?
No, you are born with all the eggs you will need as a woman. So you have to protect those eggs, guard them carefully. Otherwise, if you expose yourself to harmful stuff or substances, they will destroy the eggs.
So you also don't need to sit near people who are taking
So
shisha.
if you are in an environment where people are smoking, and then you are seated there, over time, you are taking in the smoke. So it's going to affect your eggs, it's going to affect your uterus. The uterus, tosobola kuma mwana, because of the effect of the smoking. It affects the tubes, and that sometimes can put you at risk of getting ectopic pregnancies. Okay? So what are causing tubes okubeera blocked.
But someone is going to say, yeah, I was pregnant and I was taking shisha, nothing happened
No, but
to
you
me.
see, you may be lucky that for you nothing happens to you. But then there are people who are coming to us and they want to conceive, and they've lived this lifestyle.
Okay.
Okay? So these things have an impact on us. All right? Yeah. And then, of course, age is a very key factor in terms of conception, both for men and for women.
Look, I don't start talking about age.
This is a scientific fact. I can't run away from it.
Yes.
Because the older we become, the less the quality of both the eggs and the sperms.
Maybe with age, and again, we're putting on family planning.
So family planning is not necessarily directly linked with infertility.
Wow.
Yeah, it's not. And normally, when people come for family planning, we advise them.
Okay.
And we tell them, obofuna family planning, just all affecting fertility. I know outside there, waliwo conceptions and myths
About family planning, yes. They will tell you too much of family planning, you're not going to conceive.
Not really. Family planning will only stop or prevent you, if it's hormones or what causes hormones, it can stop you from producing your eggs at that time ngo causes a family planning. But after you've stopped it, your system resets back to normal and you resume with the process.
Okay.
Well, there are family plannings nga IUDs. They don't affect, especially the non-hormonal IUDs. They never affect your eggs. Kati osigala nga amagi go gakola ki? They get formed every month. Your eggs are getting formed and released, so it doesn't affect your fertility. Now, of course, it's a misconception out there nti oba oli ku family planning
togenda kuzaala.
That is not necessarily true.
Okay. So you were talking about age.
Yes.
Which age?
So the best age for reproduction, and this is evidence, these are facts, not my stories. The best age for reproduction is normally between about 22 to about 35 years of age. That is the time when amajigo gali in the best quality. Okay, best quality around that time. For men, the best time of conception should be before 40 years of age. Okay? So when you clock 35 years of age, it's like you had wakumye chintu mu store kumala banga. So the longer you keep something in the store, the more older it becomes. Sicho?
Yes.
Oba ina motoka n'otekawo ku gundi ku garage, then you leave it there for 10 years, then waliwo mulala yamuleka for 15 years. The person who has left it there for 15 years is going to have, the car is going to get more spoiled than someone who has left it there for 10 years. So when you reach 35 years of age as a woman, the rate of decline of the eggs is faster. Okay? So meaning when someone clocks into their 40, 42 years of age, 45 years of age, that person has, the quality of those eggs are less than the quality of the eggs that were there ngoli less than 35 years of age. Okay?
But still I can conceive.
Yes, you can conceive. But also we tend to see abnormalities. Abantu bani bafuna abnormally formed babies. Abaina Down syndrome, Edward syndrome, abana baina they give birth to them ngabaina a bit of abnormalities. Chija mostly nga emyaka gikoze ki gigenze when the age has actually transpired.
So doctors can't prevent that. You don't see that I'm going to have an abnormality.
So as a doctor, I can screen you.
Yes.
For example, I can ask you into my family what I want, what bazadabana. So if you tell me that, then I will be more cautious. There are tests to sobola when the pregnancy is still young to see if that baby is formed well or there are abnormalities in the baby. Okay? There are tests that we take off in the blood and we do genetic screening.
Okay.
There are tests like scans. The scans we do in the first 3 months of the pregnancy, around 11 weeks to 14 weeks, there's a scan we do to tell if there's a problem. Then, in the second trimester, to call what we call a 3D scan. And if you can do a 3D scan, it helps because it can tell if the baby has formed well or not. So as doctors, we can only investigate early when you're pregnant, okay? But I cannot tell if I look at you, you're going to give birth to a baby as an abnormality. Not necessarily. But we know that it's common among people where the age has transpired. Even for men who are more than 40, 50, 60, their sperms are not as really, really good quality like men who are below that. So that also can predispose you to getting a baby who has got problems. So age is a very, very important factor in the discussion of fertility.
So you advise us to give birth between 20 to 35?
You know, giving birth is a different thing altogether. But if you can, yes.
Okay.
If you can, yes. But also in the current era, you can also keep your eggs.
Oh,
yes. So if you realize you're going to be a career person, you're going to be busy during that time, you can come at 30, we can harvest the eggs and freeze them for you. So when you freeze those eggs, we freeze them at 30 years. So when you come back and go to 40 or 45 and you say, I want to use my eggs, we shall use the eggs and we shall use them at the age of 30.
What if I've already separated with the person?
But they are your eggs.
Oh, only eggs.
Eggs. We can freeze only.
Only eggs without mixing them with the sperm.
That is, but also we can freeze the egg and the sperm. I mean, we can freeze what we call the embryo. And freeze it. And then when you want to have a baby later, you come and say, okay.
So at 35, I cannot come.
No, you can come. So the earlier you
freeze the eggs.
The earlier you come, the better. Because if someone comes at 48, the quality of those eggs are really, really not good compared to someone who froze the eggs at 38 or 40 years of age. And also we know that as the age progresses, for women, you approach what we call menopause.
Yes.
All right? But even men, we have andropause. Yes.
I've never heard of that.
Even men reach a point when...
They said men, even if they reach 100 years,
it's not
they will
certainly
still give
true.
birth.
Yeah. So andropause is common around 70 years of age. About 60, 70, we start approaching andropause. So we also start getting the symptoms that women get when they reach menopause.
Wow.
Yes.
Like, this is new. So abasajja balekera ozaala nabo.
Yeah.
But they said abasajja paka kufa till death.
So you can notice the older the man, the babies who are born are having more issues. Yeah. So the earlier you conceive, the better. All right. Or the earlier you freeze your eggs, the earlier the sperms can also be frozen. The earlier you do that, the better for you.
Okay. So doctor, allow me to raise this question in Uganda because the one who was asking
was in Uganda.
Yes. I have a woman asking, afune embuto, she conceives.
Yes.
And whenever bwezituuka ku myezi 7 bamugamba amazzi gabaweddeko abaana.
Okay.
So ne bafa. Munda ne babajjamu nga bafu. N'agamba yafuna olwokuna the 4th pregnancy abaana bamugjamu nga premature. But again era omwana teyawona. Yafa mu nursery. Abuuza ayinza kubanga alina buzibu ki? Majige ge mabi oba sperms za mwami?
Not really. So when you get pregnant, the most important period of your pregnancy are the first 3 months.
Yes.
Very, very important because that is the time when the baby, omwana alikola ki, aforminga bulungi.
Yes.
Unfortunately, abantu bangi bajja kudwaliro nga ziyise emyezi 3. Either because you are waiting for your periods. Okay? You've missed this month, no gamba kale. Can in the next month. By that time, it's already the 2nd month. So by the time people come, they come when it's a bit late. Tebatandise supplements early. Okay?
Oh, you need to be on supplements.
Yes. Okay. So especially the folic acids, they're very important for the baby to form very well. Okay, whether it's pregnant care or whatever supplements, but your doctor can recommend you to start those supplements. In fact, you're supposed to start them before you get pregnant. Okay, so the first 3 months are very important because when the baby forms there is nothing we can do to change that baby. Oba formize bulungi asigala nga ali fine. If it doesn't form well, your body can detect into mwana ono tali fine and it will want to reject it and get it out. That's why most miscarriages that happen within the first 3 months are because the baby didn't form well. All right. When you transition to the 2nd trimester, there are other things because now there it means the baby has formed. If the pregnancy can go beyond the first 3 months, the high chances of the baby is okay. All right. So then other problems start coming into place. For example, the cervix omumwa gw'abaana eri weak, what we call cervical incompetence. Okay? And it's very common in the 2nd trimester. Until the baby now becomes heavy, a nigger cervix presses on the cervix, and now the cervix starts opening and that pregnancy can come out. Right? There are people who get what we call preterm labor. Preterm labor means labor before the right time.
Yes.
So when you get preterm labor, you are likely to get premature delivery. In our setting as Uganda, we are looking at about 25, 26 as the time that can help your baby survive, depending on the center you go to. Okay? So the longer the baby stays munavana, the higher the chances of surviving. If the baby comes out early before you've reached 37 weeks, you are a premature baby. So the closer it is to 37, the better. For that patient, we cannot tell whether the cervix was weak that made the sac to bulge and maybe the water to come out. And if that is the case, there are interventions. If you go to hospital, your gyne will be able to put a stitch. Okay? Barasobola kusiba omumwa gwa n'abaana ebeere tight so that that tight cervix does not allow the baby to come out. There are also medicines we give to that pregnant woman to allow that baby to stay awo munda without getting contractions. So it's very important that you go to your doctor early. If you have such a problem when you conceive, get down. As soon as you conceive, go. There are special medicines that you are going to be given that actually help you to keep this baby inside. That person, unfortunate, or that person does not have infertility. Kubanga asobola kufuna olubuto.
Yes.
Okay?
Yes. But she has 7 miscarriages
Our only
now.
problem is keeping that pregnancy inside there. So she has to come and we assess what could be the issue and how can we address it.
Okay.
Yeah.
So amazzi ge gabe omwana bw'aba tagalina obviously abalina kufa.
Yeah, so the water, amazzi ago gali very important ku mwana. That water is very important to the baby. Why? Because that baby drinks that water. The water helps the lungs to form, to expand. That water helps the stomach, the intestines to be open, to form well. That water helps the baby to be cushioned. Weba mama tambula, waliwo forces ng'olinnye wansi. So that force is absorbed by the water, so that it doesn't go to the baby. So the water is very, very important. If the water pours early, before 37 weeks, it means that you're going to affect formation of the lungs of the baby. You're going to affect the stomach or the intestines of the baby. You're going to, even infections can enter.
Yes.
Is affecting a mwana, okay? You're going to get contractions and then actually push that baby. So it's very important that your water does not break early. By early, I mean before 37 weeks. At least.
Oh, that's the water that break when
yes. So that water should break after 37 weeks.
So doctor, someone told me nti omwana bw'aba mu lubuto ng'atudde mu uterus ate abeera atudde mu urine ate oŋŋambye nti omwana anywako gagira amawuggwe like kati omwana aba anywa urine.
So that water has a special composition. Amazzi ago gajja one from the skin of the baby. So when the baby sweats mu uterus, that contributes to the water. It also comes from the uterus. There's the wall of the uterus. The baby also does susu kumazi. The difference is that urine of the baby doesn't have toxic wastes nga urine yes, of a person who has been given birth. So that urine is very neutral urine. It doesn't affect the baby. So that's why babies who have a chizibu ku nsigo, kidney issues, will end up having little water because they are not contributing that urine as well. So that water has a lot of compositions and comes also from the baby's urine. But it is very natural and healthy for the baby. It helps to do the role that I've talked about.
So bwegaba amazzi nga matini mama alina okweraliikirira alina okugenda mu ddwaliro because omwana ayinza okuba ensigo ndwadde.
Yes. So usually if the water is little, scan esobola kukebera mwana bulungi nakebera ensigo za mwana
ne balaba oba
yes, if the kidneys are okay or not. Okay, that is of course if the water has not poured out.
Yes.
But also when you reach towards the end of the pregnancy, ng'oli kumpi ne 40 weeks, naturally amazzi gakendera naturally. Yes.
Gaba gafuluma.
Yes.
Okay. So ndowoozaako tukategedde bulungi. So Dr. nja kubuuza akabuuzo kange akalala wano nga tumaliriza. So is it okay for me to accept to abort any abnormal child before birth?
That's a tough,
as a mother?
That's a tough question, but we have laws that guide in terms of that. For example, weba tukebedde ne tusanga nti mwana ayina abnormalities nyingi nga that baby cannot survive. Tuyogera ne abasawo w'abaana. We discuss with the pediatricians. And we ask them, this baby with this problem, can the baby survive? If the pediatrician tells us the baby cannot survive, then we advise the mother that it is not, we can consider stopping that pregnancy at that point when we have discovered. And it's better that is done early, okay? Especially maybe before or around 5 months, okay? So that you don't struggle with the pregnancy for 9 months and then the baby does not survive, okay? Yeah, so abnormally formed babies, as a doctor, we need to discuss with the patient. Then give them the options, that there is an option which is legally accepted, that the baby is not well, cannot survive, so you can stop this pregnancy. But also the couple must decide. Sometimes we get couples who say, let me carry my pregnancy. But it comes from a point in the yeah. So we discuss with the couple, then we guide them. Then they are the ones who decide if they want to stop the pregnancy, but it is legal, it's acceptable, or they want to carry on with the pregnancy.
Okay. Okay. So I have another question here about fertility. She's saying they have checked her and they say everything is okay, but she does not conceive.
Very good. So when we are checking for infertility, tukebera mchala ne
No mommy.
no mwami. So it's very important that even when you're going for fertility treatment, go with your partner. Because there are many times, like I told you last time, that men combined cause about 40 to 45% of infertility. So there are many times I check the woman, and I not any problem. She has no problem whatsoever. And yet, the challenge could be on the husband's side. Okay? So it's very important, if she has done all the tests and checkups are okay, and she's fine, that is good. So now we need to evaluate the husband.
Tebakiriza.
So the thing is, don't just, when you're telling your partner, don't tell him nti tomugamba nti kirabika gwe alina kizibu nedda mugambe musawo agambye tugende ku ddwaliro. There's something he wants to discuss with me or with us. So when he comes to the hospital, now for us as the doctors, we're trained to discuss with him. Then we tell him
in a professional way.
In a professional way. Sometimes we want to do a sperm checkup, but if you go and tell your husband they want your sperms,
Yes.
so for you, make it a point to bring him to hospital. You can even say, doctor has found some issues he wants to discuss with you about how we can conceive. So when he comes, for us, we know how to handle with that and ensure that we're able to check the husband and then find out where the challenge is. There are 10% of couples who have no problems. The husband is very okay. So that is called unexplained infertility. It means that we have taken the history, tumukebede, to cause tests, and all those things are perfectly fine. We have done that for the man and for the woman. If that is the case, then the infertility is called unexplained infertility. And there is a special way we go about it. Okay? Either we can give them some time and we tell them go back home. If it is stress, go on a honeymoon. Okay? And some of them come back within 3 to 6 months, come back when they're pregnant.
Oh.
Yes. Sometimes we can give them medicines to stimulate the eggs, or kusembeza maji. Okay? Much as it's not the practice or recommendation, but we can do that, and then we find they come back when they're pregnant. Okay? Sometimes we can even get the sperms of the husband. Netuteka munda muchi nabana, what we call IUI, intrauterine insemination, and that can also help them to get pregnant. So it is very important to find the cause. All right? If you don't find the cause, it's also okay, because there are people where we don't find the cause. But there are steps that we take, action steps that we take to help that person or that couple to get a child.
Okay.
Yeah.
So another question, painful periods, and I'm not conceiving for 3 years. May it be the problem why I'm not conceiving?
Painful periods should never be taken for granted. Never. And currently, there is a lot of information that people are sharing about endometriosis. Okay? We have found out that there's so many women who have endometriosis and they do not know. Okay? Painful periods can mean that the layer of the cells that are supposed to be inside the nirvana are not inside. Okay? Yes. So, I don't know. Let me explain it simply. In the uterus, there are cells that are supposed uh, to 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 allow the baby to grow. Okay? There are cells where when the baby has formed from the tube, it comes inside of the nirvana or the uterus and then attaches there and then it starts to grow. Okay?
Yes.
Those cells are called the endometrial cells or endometrium. Okay? So if those cells are present, they're only supposed to be munda wanache navana, only inside. If those cells are also present outside of the uterus, it means that ngogenda mu period, when you're bleeding during the period,
Yes.
those cells outside of the uterus are also bleeding.
Oh.
So that usually triggers too much pain during the time of period. So it's very important that any person out there who has painful periods comes and sees a doctor.
Is it treatable?
So there are different ways we approach it. Sometimes we approach it with medications. Sometimes if it is deep endometriosis or if it is
Nina mukwano gwange bwagenda mu periods. Bamuteka ne ku kitanda. She's always admitted.
Yes.
Every month she's admitted. Naye bwazivaamu ng'atereera.
Yes. So
But
that,
naye tannaconceiving but bamugamba nti bw'anaazaala ng'atereera.
so there are people who have what we call primary dysmenorrhea. That person naturally,
Bw'atyo bw'ali.
the periods are painful. But it comes from a point in the tukebede buli kimu
Nga kiri okay.
nga kiri okay. Then we say, okay, this is primary dysmenorrhea. Periods change, bubachala. They change. You cannot have the same periods from the time you start until you reach menopause.
Yes.
Bichuka. So some women start with painful periods. After giving birth, the pain resolves. There are people who start with no pain. After giving birth,
It starts.
or later in life, the pain comes. So they keep on changing. But the message is the pain should not be too much. It should not put you muchitanda. Should not make you bedridden. You can't go to work. It should not do that.
It should be normal.
It should be bearable pain. You get it? And so we advise anyone out there who has very painful periods, don't sit on it. Don't feel into kuguma nzendi na Uganda.
They take painkillers.
Yes.
Those strong painkillers.
Come and we check to be sure until you don't have endometriosis. To be sure until enough fibroids. Even fibroids can cause painful periods.
Yes.
Okay. To be sure you don't have adenomyosis. Okay. These are all conditions that can affect the uterus, and we want to be sure until you do not have them. Okay. Because when you have them, they can be addressed. They can be solved, and then you have bearable or painless periods.
Okay. So ako mukategedde bulungi eyakabuuzizza. Olina okujja mu ddwaliro bakkebere balabe oba buli kimu kiri bulungi kuba tolina kuba na periods zikuluma nnyo nga kisusse ku kirina okubeera. So doctor, our last very question is ono abuuza nti nga yagenda mangu mu menopause at 38 yalekera okufuna periods ze. What might be the problem?
So the average age of menopause in our setting,
Yes.
let's say Uganda, is about 50 to 55 years of age. Yes. That's the average age.
50.
About 50 to 55.
Okay.
Okay? But menopause tends to follow genetics of family. For example, one mama to menopause at 40. If your mother got into menopause at 40, there are high chances you'll get into menopause at 40. So if you are out there, find out if your mother is still alive, find out the age she got into menopause. Find out the age your aunties on your mother's side got into menopause, because that's likely going to be the time or the period when you get into menopause. All right? Any person who gets into menopause before 40 years of age, that is called premature menopause or premature ovarian insufficiency. It takes until that your eggs have got finished very quickly. Because you only reach menopause when your eggs have got finished. Okay? Now, like I said before, women are born with all the eggs. So you have to protect them. Okay? Sometimes when you're exposed to harmful substance, I talked about cigarette smoking and
Yes.
alcohol, okay? Those ones can predispose you to depleting your eggs, but also radiations. Okay, people who get exposed to some of these machines, the CT scans, the X-rays, and all that. Okay, some of those can affect the what? The eggs. There are people going into cancer treatment early, and the eggs are not preserved. That can destroy the eggs faster. Okay, there are some infections, diseases that can go and affect the ovary. Okay, so and people take it for granted. So when you have issues around the ovary, go to the right doctor. Okay, sometimes you go and in a system ovary, then the person removes the whole ovary, when it's not supposed to be the case. So go to the right people so that they can try to preserve your eggs. Okay. So for that person, we cannot tell that so many causes that can lead you to that. Sometimes it could just be genetics, family, that these people, for them, menopause happens at 40 or 45. You get it. So you need to get that history as well, but also we need to investigate.
Can regular sex prevent early menopause?
Regular sex.
Someone told me that.
There are no scientific studies that show that regular sex prevents menopause. So it may not...
Early menopause.
It may not be necessarily true that regular sex can prevent early menopause.
Oh, so they told me that if we go to in menopause at 50, you can have them at 60. That is, if you have a man around you.
The presence of the man may be to help to be a supporter, but not necessarily to prolong the time you get to menopause. Because during that transition, menopause is normal. And people should not fear menopause. It's a normal transition.
But what comes with it?
There are people who transition through menopause without any challenges. Okay? Then there are people who have a tough time transitioning. Because this is your body trying to adjust. That I have finished this phase of reproducing. So now I am adjusting to the next phase. So your body has to adjust. Some people take 3 months to adjust. Others take even 10 years to adjust. Okay. So, but when you have a treatment, you have a supporter, your husband is present, he's able to encourage you, he's able to motivate you, he's able to go with you for consultations. That psychologically helps you, because even menopause transition can affect a person psychologically. Okay. You are there, you're getting hot flashes. Okay. You may have weakness, magumba on the bones. You may have vaginal dryness. So if you have a husband or a partner who understands you're going through a transition, they will not be harsh on you. And then that makes it easier for you to transition. But not to prolong. Not to prolong.
Okay. So, Doctor, akabuzo kanga akazeemu bulungi abadde baŋŋamba nti sobola okudireyinga ku menopause singa obeera wegattagatta, but it's not true. It's not true. So if you have any question that is not answered, you can comment with your question there. Doctor will answer, or someone will come and answer those questions from TMR. Thank you so much. Mwebale kubeerako, mwebalire ddala. Thank you, Doctor.
Pleasure.
We will be back here next week. Tumubuuze Doctor ebibuuzo byaffe ebirala. Yes, ku fibroids. We shall talk about fibroids next week.
Okay.
So mwebale nnyo, mwebalire ddala. Leero twogedde ku fertility. Nsaba Mukama abankuumire n'omukyala ali eyo ng'olina ky'oyagala okumanya jangu mu ddwaliro. Dokita kebere bulungi akubulye nti kino ky'olina otandika obujjanjabi ng'obudde bukyali. Musiibe bulungi, mweraba.
Thank you.
Executive Media. Focus, innovate, succeed.